I want to talk to you today about health and social care, one of the key issues facing our country. You may not know that, as well as being a councillor in Liverpool, I also lead for the Local Government Association on health and social care issues. And where better to come to talk about this issue than the Royal Liverpool Hospital, or rather what should be the Royal Liverpool Hospital, which is behind me. This indicates two of the problems that we have with the health service. The first is that this hospital was commissioned by Andy Burnham, the Labour Health Secretary, through the PFI model. That's left not only us with huge debts for this hospital, but the NHS with problems throughout the country, with huge debts which have to be made as the first charge against your taxation before any patient is helped. Liberal Democrats don't believe in a privatised health service. We want to see it kept free at the point of need for everyone in this country. But the other thing that this hospital shows is we're actually spending the money on the wrong things. When the hospital is finished, 10% of the people who will be in this hospital at any one time will be people who do not need to be there. They're people who are elderly or have other physical conditions which would be better and more cheaply treated in the community, but we don't spend the money that way. 10% of the people who will be in the hospital are suffering from drug and alcohol related uses. That could be prevented if we spend the money up front on prevention services rather than trying to cure the problems. And lastly, 10% at least of the people in this hospital will be suffering with problems caused by obesity. That can all be prevented. Those are the sorts of things that the Liberal Democrats want to do very differently for our elderly, for our ill, and to stop people becoming ill in the first place.